Hi, welcome to Dental Canvas. I am Dr. Gopal Kasat, and in this episode, we will be discussing the anatomy of the maxillary lateral incisor. Before going ahead, if you are new to this series, refer to the video in the description or on the right top corner to learn basic terminologies required for a better understanding of this video. As maxillary lateral incisor has keen resemblance with maxillary central incisor, I will mention the key differences throughout the video. Now let's move ahead and start with the labial surface of the maxillary right lateral incisor. The labial surface of the crown is more convex and the average length of the crown cervico-incisally is 9 mm, which is 2 to 3 mm shorter than the central incisor. Mesial outline of the crown from the labial aspect resembles that of the central incisor with a more rounded mesio-incisal angle, and crest of the contour is usually at the junction of the middle and incisal third. The distal outline is more rounded than the central incisor, and the crest of curvature is more cervical, usually in the center of the middle third. The mesiodistal diameter of the crown is 6.5 mm, which is about 2 mm narrower than the central incisor. The mesiodistal diameter of the crown at the cervix is 5 mm. Now let's move on to the root. The root is about 1.5 times the length of the crown, which is about 13 mm in length. Root tapers evenly from the cervical to approximately 2/3 of its length apically. It curves sharply from this location in a distal direction and ends in the pointed apex. Now let's move on to the lingual aspect. The outline of the cervical line is similar to the labial aspect, with the curvature root-wise. Below the cervical line, there is a smooth convexity known as cingulum, which is followed by a concavity known as lingual fossa, which is more concave than central incisor. Mesially and distally, congruent with the cingulum are the marginal ridges which outline the lingual fossa. Incisally, the lingual fossa is lined by the linguo-incisal ridge, which is well developed in lateral incisor. Now let's move on to the mesial aspect. The mesial aspect of the maxillary lateral incisor is similar to that of the central incisor. The labiolingual diameter of the crown at the crest of the curvature is 6 mm and is about 1 mm narrower than the central incisor. Labiolingual measurement at the cervix is 5 mm. The curvature of the cervical line is 3 mm and the curvature is towards the incisal ridge. The root appears as a tapered cone from this aspect with a rounded apical end. A line drawn from the center of the root tends to bisect the incisal ridge of the crown and apex of the root. The width of the crown distally appears thicker than the mesial aspect because of the placement of the crown on the root to adapt to the dental arch. The curvature of the cervical line is 2 mm and curvature is towards the incisal ridge. From the incisal aspect, the lateral incisor resembles the central incisor except for the size. It exhibits more convexity labially and lingually from the incisal aspect than the maxillary central incisor. Sometimes the labiolingual dimension is more than that of the mesiodistal dimension, with a more prominent incisal ridge. In those cases, teeth from this aspect resembles a small canine. That completes all the 5 surfaces of the maxillary lateral incisor. To summarize it all, you can see a picture on the screen with all the average dimension and key features. To download the same and refer our resources, check the description. If you have learned something, hit the like button and feel free to subscribe. Don't forget to comment. Thanks for watching. I am Dr. Gopal and you have been watching Dental Canvas. See you all in the next one.